everybody's doing good today. My name is Jarvis Harrison. I'm the marketing advocate for the Middle Tennessee region directly for Blue Cross Blue Shield of Tennessee. So I work directly for Blue Cross Blue Shield of Tennessee. Basically, my job consists of me going from community to community to educate individuals about the new marketplace. There's so many questions, and Blue Cross's true, basically will, when all this started, was to be able to educate the everyday consumer about questions about their insurance, because a lot of people want to know what's going to be best for them and best for their families when it comes to purchasing health insurance. And so I do that. I go and talk at various communities in the Middle Tennessee region. I'm up to, in Clarksville all the way down to Lawrenceburg, Pulaski area, just about every day of the week, holding a community meeting to educate individuals. I also talk to civic individuals, as well as I try to go to different counties to ask individuals about events that they may need information on. And really our goal is to be able to get you as the consumer information that you need. Not only when it comes to choosing your health insurance, but if you are choosing Blue Cross Blue Shield of Tennessee, there's a lot of questions that you may have regarding insurance, regarding policies, regarding plans that are out there, as well as different networks. There's different types of things that to take into consideration when you're purchasing health insurance. And a lot of people, this is kind of new to, especially when it comes to selecting insurance that's just right for them, as well as networks that are just right for them. And so, again, I'm in the Middle Tennessee region. We have so many good things that we foresee, especially when it comes even with women's health care, pre-existing being done away with, maternity benefits being added, all types of wellness services being covered at 100%, even the aspects of chronic disease management when it comes to dealing with mammographies or colonoscopies, or those things that are going to help you to stay healthy over the years. We're really trying to push the advocacy and being educated on those things. So again, my name is Jarvis Harrison. If you have any questions for me, please feel free to ask me, whether it's with the insurance or with Blue Cross Blue Shield of Tennessee. And I'll pass it on to Michelle.
Thanks. Hey y'all, I'm Michelle Johnson. I'm an executive director of the Tennessee Justice Center. We're a nonprofit public interest law firm. We've been around about 18 years, and our focus has recently been, well, really the entire time we focused a lot on making our healthcare system more humane and compassionate. So we serve about 400 individual clients a year, and then we work with larger groups of folks on making the system more accountable. So we also train lots of providers and social service providers on this complex healthcare system that doesn't always work the way it's supposed to. So been really excited to see how the Affordable Care Act unfolds. Though we have instituted primal screen therapy in our office as we enroll people. It is frustrating, and it is unbelievably exciting. People who've never had health insurance before are getting covered, and for 18 years we have had weekly case reviews for people who call in and it's not working, and the weekly case reviews have been children with brain cancer losing coverage, moms who are pregnant not having coverage. And we are experts on what the law is, and there is literally no way to get these people covered. And I think a lot of people in America don't really believe that. They think if somebody's really sick, surely there's a way to get them covered. And if our governor had said yes to the Medicaid expansion, that would have been primarily true in our state, but he has said no. So. But it's very exciting that we're getting lots more people covered, and I'm really excited to be here with you today because there's so much misinformation, and it's important that we have some truth told so that people get the information they need to get covered.
My name is Merle Lenahan, and good afternoon, everybody. I'm glad to see you here, and I appreciate the invitation to be here as a panelist. I'm an obstetrician and gynecologist, and I spent, after being in private practice, about 6 years running a free women's clinic. And after starting the clinic, I discovered that, as Michelle just said, most of us assume if you need health care, even if you have a low income, even if you're uninsured, you can get it. And I found that assumption was wrong. And I actually ended up going back to school to learn more about our health care system and about health policy. And so it was a life-changing experience being at the free clinic for me. And today, I just want to spend a couple of minutes talking to you and trying to give you a mental image of how we can understand healthcare. And so I have three things I want to bring up in your mind, and those three things are body parts, lifetimes, and emotional well-being. So first, body parts. The way our healthcare system has worked for low-income women is largely according to body parts. So for instance, if an uninsured woman with a low income has something like cervical cancer, there are programs to provide insurance for that, and advocates for breast and cervical cancer worked for decades to get that coverage. And if that same woman has cancer and it's a few inches in either direction, our healthcare system has been such that there's no coverage for that. So one way to think of potential changes, especially if Tennessee does expand Medicaid, is that women will be covered as if they are whole persons with a lot of different body parts. And the second thing I asked you to bring up in your mind is lifetimes. So at the free clinic, many of the women I saw had raised their children and were not yet 65 and eligible for Medicare. Most often they didn't have or weren't offered insurance at their jobs, and they weren't eligible for Medicaid because in most states like Tennessee, once your children leave home, you're no longer considered to have dependent children and you're not eligible. And also, in states like Tennessee, we cover women for certain parts of their lives, for instance, pregnancy, at income levels that are higher than at other times, but it only lasts for a few months, so that a few months later, women are back again, potentially without health insurance. And so the pieces of the Affordable Care Act work together to get people covered over their lifetimes. And the third image I wanted to bring up was emotional well-being. And there recently, some researchers in Oregon, this had nothing to do with the Affordable Care Act, but they looked at people who had been randomly provided by lottery with Medicaid insurance. They were all low-income people. And they looked at each of those groups and found that one of the most important findings was that people who were covered by Medicaid had a better sense of well-being, and they were happier and less likely to be diagnosed with depression. And the ability to get care was more predictable, and the worry over the cost of their care was far less. And I have to say that emotional well-being is better for doctors and providers when patients can get the care they need. And then I just want to finish by talking about something transformational in the Affordable Care Act for all women, and back to Jarvis with the prevention and wellness. And we know that we are better off, and we've talked about this for 150 years, when we prevent health problems and if we focus on wellness. So the Affordable Care Act focuses a great deal on preventive care, and even in private health plans, much of that is covered without a copayment. So mammograms, immunization, and contraception are among those that are covered, even in all the private health plans.